the questions are, why is my discharge smelly? Why does it have a foul smell? Why is my discharge having an abnormal color? Green, brownish, yellowish. And finally, why is my vulva itchy? Hello everyone, and welcome to the Health, Medicals and Lifestyle channel. I'm your favorite medical microbiologist, Wendoline Halley, and stay tuned for more. Today we'll be talking about bacterial vaginosis caused by the bacteria Gardnerella. This infection is normally caused in women of a childbearing age. So if you're between the age of 25 to about 40, I think every woman has had this infection once in their lifetime. So what causes bacterial vaginosis? Is when there's an overgrowth of this bacteria, this Gardnerella bacteria in the vagina. If you've been watching my previous videos, I've been talking about the pH of the vagina and the good bacteria that's normally found in the vagina, and that is lactobacilli. That is responsible for keeping the vagina in its healthy condition, in that good acidic condition, and that helps and also cleans the vagina and prevents any form of infection. A lot of people mistake bacterial vaginosis with candidiasis or thrush. No, they are not the same. Candidiasis or thrush is caused by fungi known as Candida albicans, while bacterial vaginosis is caused by a bacteria known as Gardnerella. So what are the differences? With bacterial vaginosis, you have this foul discharge and no inflammation of the vulva. On the other hand, thrush or candidiasis doesn't have this smelly discharge, but has like a inflamed vulva. It inflames the vulva and sometimes the clitoris. It causes this funny sore sensation around the vulva and the clitoris. How can bacterial vaginosis be diagnosed? So when we go to the hospital, we'll have vaginal swabs, and that will be taken to the microbiology lab, and they will be cultured. The second form of diagnosis is a pH strip will be inserted into the vagina, and the pH of the vagina will be noted. And if the pH of the vagina is above 4.5, then that means that there's an infection in the vagina. The third is the doctor or the medical microbiologist or whoever is taking the swab will actually have to insert two of his fingers or two of her fingers into the vagina while placing the other hand on the lower part of the woman's abdomen to actually check if there's any form of pain around that area. So what are the symptoms? The symptoms is pain during urine. Most women experience pain while urinating, and most times it leads to pelvic inflammatory disease. So whenever you're having this pain around the lower part of your abdomen or while you're peeing, please go and get checked. Go and get checked, because you'll be feeling that pain on the lower part of your abdomen. The next is the foul smell. You have this irritating foul smell that cannot really be masked with good perfumes. That when you take out your underwear, you will know that you are having an infection. The next is the change of discharge. The normal discharge for a woman, or color of discharge for a woman while she's ovulating or all through her cycle, is normally cream white in nature. But when your discharge is as when you are not on your period, if you ever notice that you have gray discharge, your discharge is gray in color, yellow in color, green-like in color, and brownish in color. I'm not talking about the little brown droppings that come after your period. No. Know that you need help. You need to go to the hospital and get yourself checked up. And also the next symptom is that your vulva will be itchy. When I talk about vulva, I'm talking about the outer part of the vagina. the labia minora and the labia majora will be itchy. So there you know you need to seek medical attention. So how can we prevent bacterial vaginosis? The first is, do not sit in a wet bathing suit. Do not wear damp or wet underwear. Not good. Avoid taking antibiotics for a long period of time. Next point, make sure you clean yourself after doing number 2 or after defecating, from the front to the back, not from the anus to the vagina. Clean from the vagina area, from your clitoris area to the back. And that will prevent feces from entering into your vagina. Also, avoid taking a lot of sugar and pasteurized milk. This bacteria, Gardnerella, thrives and loves feeding on pasteurized milk and sugar. Next point, take probiotic yogurt. I'm talking about yogurt that contains lactobacilli. After 2 weeks, make sure you take a good quantity of it, of about 500 grams. And try not to take that which is very sweet, because it may provoke the growth of this bacteria in the vagina. Next point, try to drink also apple cider vinegar once every 2 weeks. You mix it with water in a glass and you can take. The next is, you can take garlic. Put raw garlic in your diet, or if you want to cook with garlic, make sure you put a good quantity. That will help so much to prevent the growth of Gardnerella. Next point, don't wear tight cotton pants or non-cotton pants. That may actually block the ventilation around the vagina and promote this bacteria to grow. Remember that Gardnerella is an anaerobic bacteria. That means it thrives where there is no oxygen, where there is airtight, where there is no air flowing. Next point, avoid having several sexual partners. And this can mostly be transferred from one female partner to another. That is for those who are gay. They are most likely to have this. And those who are practicing oral sex, please be cautious to protect yourself. Next point, make sure you use unscented, undeodorant, unperfumed pads, tampons, soaps, and also condoms. Many women who suffer from this because they use scented condoms. And these scented condoms alter the pH of the vagina. That area, lactobacilli, cannot really thrive when it's altered. Also, make sure we use condoms, the female condoms and the male condoms, while we are intimate with our partners. For the treatment, Gardnerella, the bacteria Gardnerella, is an anaerobic bacteria. So we need antibiotics that will kill it and eradicate this infection or eradicate this problem. And we are looking at metronidazole and also tinidazole. And you can take these, as prescribed by your doctor or prescribed by your pharmacist. And also make sure you take apple cider vinegar every week, or you can take every day for a week and then you stop, and make sure you include this probiotic yogurt, this yogurt that contains lactobacilli, so that it can restabilize the pH of the vagina. If you have any questions, don't forget to pop them down below or send me a message. Till next time, I'm your favorite medical microbiologist, Gwendolyn Halley.